cervical anatomy, the triangles of the neck. These anatomical zones aren't just theoretical divisions. They serve as practical guides for surgical access, trauma evaluation, and diagnostic precision. The neck is divided into two major triangles by the sternocleidomastoid muscle. So remember this. It's divided by the sternocleidomastoid muscle. The anterior triangle, which lies in front of it, and the posterior triangle, which lies behind. Each of these contains vital structures and is further subdivided into smaller triangles that we'll explore in detail. Understanding these regions help us navigate everything from lymph node biopsies to vascular procedures with confidence and clarity. So, let's take a closer look at how these triangles are defined and why they matter.